You will also set FiO2.
Thing is doubt. We need to get the clarity
I will
from
send
your
you
notes.
notes, okay? But listen, one thing, if you're not playing with your shastra, if you're not playing with your weapon, and your weapons are your question papers, if you're not playing with your questions, nobody can pass this also. You should know how to read question and how to do question, okay? Practice question as much as you can. Just practice 85 question per day should be your benchmark. You should not sleep before doing 85 questions. Okay, you have UWorld, practice on UWorld. You have Archer, practice it from Archer. Okay, your boot camp, Archer. There are so many other. Kaplan, best, good, but very difficult. Don't start with Kaplan at the very end.
Sorry, once again, please. We need to note down.
No, I will teach you. You're a very initial. Just be with me for 1 month. Then I will teach you what to do. Okay, let's study the basics. Then you will eventually you will be very good with the knowledge. Okay. I was talking about ventilator. We studied about ventilator. We studied about mode. Now let me tell you some model points related to this. First is your FiO2. It is the fraction of oxygen. So just imagine this is 1 liter. This is 1 can. And this much is your oxygen and this much should be air. So how much, what is the fraction? So 2/3. So among these 3 parts, 2 part is filled with oxygen. This is the fraction of oxygen. Okay, understood? Basic, easy. This is a fraction of oxygen. There's one setting. It is not a mode. It is a setting which is called PEEP. PEEP means
Positive
positive
and
and
the
expiratory
expiratory pressure.
This is a pressure which keeps your airway open. Listen, you want some certain amount of pressure to keep your airway open, right? Otherwise, it will collapse. So this is called PEEP. Understood, PEEP?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
This was all. Now I'll tell you about ventilator alarm, but I want you to take break because this is going to be a long lecture today. So take break of 10 or 5 minutes and then we're going to come back.
Okay, ma'am.
Yes, ma'am.
Thank you.
Thank you, ma'am.
Okay, everyone, back to the class. Rupa, Priya, Farhad, Havna.
Yes, ma'am, we are here.
Yes, good to hear.
Yes, ma'am.
So you got a break after so many long days, right? I have to give you a break. I have to give you a break. Make you feel happy. Okay. The next important topic is your ventilator alarms. Okay, what do you mean ventilator and alarms? Suban Khan. Suban Khalin, are you a boy or a girl? You know, I cannot make out her name, so I asked.
Ma'am, Sumbal is female.
Okay, Suban is female. Okay. Okay, Suban is silent. Because your name, the last, what we say?
Father
The
name,
title.
ma'am.
Surname.
They
Yeah,
have a father
title.
name also.
Acha, acha. Okay, okay, Suban. I thought you're a boy. I'm so sorry, Suban, till now. Uzma, I know is a female.
Okay, ma'am.
I know.
Okay, ma'am.
Yes, I know. Okay. So let's study about ventilator alarms. You must have worked in ICU. No, we have a good
Yes, ma'am.
candidate. Uzma, working in ICU?
यस मैम, डायलिसिस के पेशेंट हम उधर ही जाके करते हैं, तो वेंटिलेटर की वो सेटिंग का मुझे पता है.
Very good. Nice. Then you must have also heard about ventilator alarms that are very irritating, and we always push that no alarm when the ventilator try to make sounds. You all have seen this thing, right? Everybody have seen this thing. This is a very bad practice. No one should do that. Okay, this is wrong. Because the ventilator have two type of alarms. First is high pressure
ਟੇਬਲ ਤੇ
alarm.
ਪਈ ਆ, ਉਹਦੇ ਵਿੱਚ ਇੱਕ ਗੋਲੀ ਹੋਣੀਆਂ ਜਿਹੜੀਆਂ ਏਦਾਂ 5 ਗੋਲੀਆਂ. ਹਾਂ, ਪੀਣ ਵਾਲੀ ਵੀ ਪੀਣੀ ਤੇ ਗੋਲੀ ਵੀ ਖਾਣੀ ਏਦਾਂ.
Yes, Priya. Then we have second is low pressure alarm. One is high pressure alarm and second is low pressure alarm.
लो प्रेशर अलार्म.
So exactly why this pressure alerts? In high pressure alarm, just imagine this is your ventilator and ventilator is trying to give the set of volume that you have asked the patient to give. So ventilator is giving this volume, and if to give this volume of oxygen to the patient, if to give this volume of oxygen to the patient, when in this condition, when the ventilator had put so much of pressure to give this fixed volume, so at that moment of time the ventilation alarm will go out. It's going to blow up. Like, you want to give certain amount of pressure to the patient, you want to give certain amount of volume to the patient. In order to do that, the ventilator has, when a ventilator is putting so much of pressure to give that volume, this is called as high pressure alarm. Then high pressure alarm will come. So you need to check is any kind of
Secretion,
blockage.
madam. Ma'am, secretion in airway.
Yes, any kind of
that
blockage
time.
due
Yes,
to
ma'am, at that
secretion.
time.
Yes.
Yes.
Then is there any kind of kink? Might be. Or the patient itself has chewed
Maybe the tube is displaced.
Tube block.
yes, tube
Tube
block.
block.
Or the patient is chewing the tube. The patient is biting the tube.
Yes.
Yes,
Any
yes.
kind of obstruction, any kind of blockage which is preventing to give that
Obstruction
fixed
in
amount
airway.
of volume to the patient. This is called as your high pressure alarm.
High
So at that
pressure
time,
alarm.
you are going to look the machine. Okay, is anything problem with the machine? Is the blockage in the machine? Okay, look at the patient. Is the patient is chewing or not? So at this time, the first you're going to look at the patient, like biting, kinking, folding, tubings, or secretions. So if there is secretion, then take out the secretion. If there is a biting, remove the biting. If there is a kink, unkink. If the patient is chewing, remove the tubing from the mouth. Understood? This
Yes,
is what you
ma'am.
have to do. The second is low pressure alarm. In low pressure alarm, listen, this is the ventilator and this is attached to the oxygen, okay? to the patient. Ventilator will blow low pressure alarm when there is any kind of
Tubing
disturbance.
leaking.
Yeah,
Tubing leaking. Madam,
yes.
just tubing to ventilator,
yes.
tubing
Any
leaking.
kind of leakage, or there is empty of the oxygen
Oxygen cylinder disconnected.
empty, or there's leakage in the tubing, then there is a low pressure alarm. Okay, understood? So disconnection of the tubing, or just patient remove the tubing from the mouth,
Yes.
or check the air leak or oxygen cylinder. Okay, next question come.